So for the first story of the day, I'm going to talk about forensic nursing. The reason I chose forensic nursing is because I've had a ton of nurses, a ton of soon-to-be nurses, a ton of people just ask, what in the world is a forensic nurse? It sounds badass, it looks super cool. What is it? How can I get into it? What should I expect if I do it? And here I am giving you those answers. So I'm getting all of this information from the International Association of Forensic Nursing. So if you've known anything about me, I am not a forensic nurse, but I did go to the source. The International Association of Forensic Nursing considers forensic nursing the practice of nursing globally when health and the legal system intersect. And I think that's important. So you might ask, what does that mean? Why do we need a nurse to take care of the health and legal? Why? Why do we need forensic nurses? And I'll answer that question right now. So per the International Association, they say victims of violence and abuse require care from a health professional who is trained to treat the trauma associated with the wrong that has been done to them. Be it sexual assault, intimate partner violence, neglect, or other forms of intentional injury, forensic nurses are also a critical resource for anti-violence efforts. They collect evidence and give testimony that can be used in a court of law to apprehend or prosecute perpetrators who commit violent and abusive. Forensic nurses work with a variety of victims when it comes to these violent acts. And just to give you a couple of examples, they work with sexual assault. So a bunch of forensic nurses are SANE nurses, and SANE nurses are sexual assault nurse examiners, or SANE nurses. Or they also work with domestic violence victims, child abuse / child neglect victims, elder mistreatment victims, death investigations, and correctional situations, or like a corrections office or juvenile institution or stuff like that. And then last but not least, in massive disasters. When I say massive disasters, I do mean natural disasters, so tornadoes, tsunamis, all of these crazy places, and along with that comes mass shootings, terror attacks. Forensic nurses are in the knee deep of legal situations where they are victims. If they are victims that are bruised, hurt, killed, whatever the situation, you can hope to find a forensic nurse. So now you know all of the situations in which you might be able to imagine a forensic nurse helping out in those situations. But where physically do you think you'll find a forensic nurse? And number one, and the most obvious, is the ER. Because all of those situations, if you are hurt, if you are a victim of any violent situation, you go to the ER to get better. But along with the ER, you can also find forensic nurses in community anti-violence programs, medical examiners' offices, corrections institutions, and psychiatric hospitals. Of course, those are not the only places, but those are the main places you might find a forensic nurse. And I just want to end with a nice quote from our former Vice President Joe Biden, because you might not hear too much about forensic nursing, and if you do hear something about forensic nursing, it might be something that you hear on the telly, on Law and Order, SVU, stuff like that. But forensic nurses do a lot, they mean a lot, and they can help in situations like the ton that I just listed prior. But Joe Biden did say this about forensic nurses. He said, and I quote, "Forensic nurses play an integral role in bridging the gap between law and medicine. They should be in each and every emergency room." I love that. I absolutely love that. Number one, getting credit for the important work that forensic nurses do. They're bridging the gap between law and medicine. Love that, love that, love that. And then most importantly, yes, we can hope. The goal is to have a nurse that is specialized, that has studied, that has a certification, a license, whatever is necessary to treat victims in those situations. Because yes, treating an ill patient is treating a patient in general. Someone who's sick, someone who's ill, someone who has a horrible disease, whatever, is the hardest thing in the world. But then on top of that, to add on top of that, someone that's gone through a violent crime, someone that's gone through a mass disaster, someone that's gone through something that is just mind-blowing outside of the actual ailments that is, causing the patient to be in the hospital. You need more than just the general studies of what all us nurses go through. I think forensic nursing is a special type of nursing. You have to have a huge heart for it, but you also have to have some thick skin. Being a forensic nurse, dealing with any and or all of these situations must be the hardest thing in the world. I'm an emotional just bubble. Anything can make me tear. I can't watch the goddamn Super Bowl commercials. Forget about treating patients, telling me their stories of these insane violent situations. To all you forensic nurses out there, please let me know in the comment section below. Did I describe the situation properly? Is this actually the things that you do? Do you actually work in the places I said that you guys work in? Again, I am not a forensic nurse, so I just got all of this information from the International Association of Forensic Nursing. But outside of that, just let me know. Comment section below. Please, and thank you.